Welcome to our pathophysiology tree of the pediatric burn patient we're going to be discussing today. First, we're going to talk about the patient information. So the patient we have is a 2-year-old pediatric patient with 30% full thickness, 3rd-degree burns on the cheeks, mouth, neck, anterior arms, chest, genitals, and anterior thighs. Next, we're going to be talking about the types of burns that people can have. There is thermal, electrical, and chemical types of burns. First, we're going to talk about the thermal burns, which is you can get from flames, too much sun exposure, a long duration on hot surfaces, or hot liquids that are non-chemical. Next, we're going to talk about electrical burns, which these are from electrical agents such as household electrical current sources, power grids, or direct contact with a lightning strike. And the final type of burn we're going to discuss is the chemical burns. These can be from household cleaning agents or work-related materials. Okay, next, we're going to talk about the depths of burns there are. So we have superficial, partial thickness, which is 2nd degree, full thickness, which is 3rd degree, and 4th degree. First, we're going to talk about superficial burns. This only involves the epidermal layer of the skin. Examples include sunburns or flash burns. Next, we're going to talk about partial thickness or 2nd degree burns. This involves epidermal and various degrees of the dermal layer. Next is full thickness or 3rd degree burns. This involves the entire epidermis, dermis, and into the subcutaneous tissue. And the final type of burn we're going to talk about, or the depth of burn, is the 4th degree burn. This involves the entire epidermis, dermis, subcutaneous tissue, and into various depths of underlying muscle, fascia, and bone. And the final thing we're going to talk about in our pathophysiology tree is the body responses from burn. You have 2 types, local response and systemic response. The local response, there are 3 zones caused by burn injuries. You have the zone of coagulation, the point of maximum damage. Tissue in this zone is irreversibly lost due to coagulation and damage to proteins. The next zone you have is the zone of stasis. Surrounding the zone of coagulation is the zone of stasis. This area has decreased tissue perfusion and in the area of the main focus in the burn treatments. Next, outside of the zone of stasis, you have zone of hyperanemia. Perfusion in zone of hyperanemia is still present in this area and is increased, causing erythema and recruitment of cells from the circulatory system. The severity and size of these zones are directly related to the size and depth of the burn injury. There is hypoperfusion in these areas, which can result in ineffective peripheral tissue perfusion related to altered skin characteristics, as evidenced by 3rd degree burns on the body, edema in the extremities, and delayed capillary refill. So now we're going to talk about the systemic response that happens to the body in a burn situation. You have cardiovascular. This consists of capillary permeability and is increased, leading to a loss of fluid and proteins into the interstitial spaces. Fluid loss directly from the burn wound combined with systemic vasoconstriction leads to hypotension and organ hypoperfusion. The NANDA for this systemic response is deficient fluid volume related to loss of protective skin and compromised regulatory mechanism, as evidenced by dry mucous membranes and skin, increased in the heart rate, decrease in blood pressure, alterations in skin turgor, and evaporative losses from burn wounds. The next systemic response we're going to talk about is the respiratory. This can be from damage from smoke inhalation, causing trauma to the upper respiratory tract, making breathing difficult. Difficulty in breathing is also a result of tissue damage in the chest area, making use of respiratory muscles difficult. Inflammation by immune factors in the respiratory system also causes bronchoconstriction. The NANDA for this type of systemic response is ineffective airway clearance related to edema and effects of smoke inhalation, as evidenced by diminished breath sounds, altered respiration pattern, ineffective cough, sputum in the airways, and visual representation of restlessness. So some other systemic responses, you have metabolic changes. The metabolic rate increases and catabolism occurs while the body attempts to recover. Supplemental nutrition is needed to meet the body needs and to combat further deterioration. The final systemic response we're going to talk about is the immune system changes. You have downregulation of the immune system response leads to immunosuppression. Patient needs nutritional support and wound care to prevent infection and support healing. Loss of fluid and proteins need to be supplemented, and interventions are needed to boost cell-mediated immunity. You also have infection is the NANDA for this. You have loss of intact skin, trauma, and invasive sites. And that is it for the pathophysiology tree of our pediatric burn patient. And I hope you enjoyed it.